Good morning to the distinguished organizers, fellow researchers, and colleagues. I'm Dr. Charlie Labarda from the University of the Philippines, Manila, School of Health Sciences. It is my privilege to present our work entitled The 3S Framework, a community-based mental health initiative for the youth. This presentation is part of our Community Engaged Medical Education program and was implemented by our fifth-year medical students in Palau, Leyte. We are grateful for the opportunity to share this work here at the 8th South Manila Educational Consortium Research Congress. This research aligns strongly with the Congress theme of truth, transparency, and transformation. It demonstrates how community-based research can transform mental health systems, especially in underserved communities, through meaningful partnerships and youth engagement. So let me begin with a question. What if we heard them before they were silent? This question reflects the painful reality that many young people struggle silently with mental health concerns. Often than not, they go unnoticed until crisis occurs. This project was implemented by the School of Health Sciences medical interns in collaboration with the local government unit of Leyte, the SK Federation, the Regional Department of Education, and the Department of Health. Youth mental health is now a global public health priority. Globally, 1 in 7 adolescents experiences a mental health disorder. Depression, anxiety, and behavioral disorders are leading causes of illness among adolescents. Most concerning, suicide is the third leading cause of death among young people aged 15 to 29. In our local context, the situation is equally alarming in the Philippines. In Eastern Visayas, suicide cases increased significantly in recent years. And in the 6 provinces of our region, 204 suicide cases were recorded from January to December of 2023. And in Palo Leyte alone, 11 youth suicide deaths were recorded between 2023 and 2024. Among youths enrolled in mental health program, depression accounted for 42%, highlighting the urgent need for early intervention. These realities demand a proactive, community-based response. This project aimed to first conduct a systematic screening to identify early mental health risks among young people. Second, to provide support through counseling and referrals. And third, establish sustainable mental health programs through community partnerships. This led to the development of what we now call the 3S framework: screen, support, and sustain. So this project used a community-based participatory approach, engaging youth, schools, health workers, and local health system leaders. Rather than waiting for youth to seek help, we brought mental health services directly into their schools and communities. This reflects the core philosophy of the UP Manila School of Sciences to bring health services where the people are. So the intervention consisted of 3 components. So we have the first is screen, where we conducted systematic mental health screening using validated tools such as SRQ-25 and SBQR, translated into the local language. And several public secondary high schools in Palo Leyte were involved in this project, and this helped identify youth at low, moderate, and high risk. So through this screening, we were able to surveyed 229 youth across the different high schools with respondents coming from different barangays. And the results of the screening showed that 58% were classified as low risk, 21% were moderate risks, and most concerning, 21% were at high risk for mental health disorders. This means that 1 in 5 youth required urgent medical health intervention. This finding confirmed the critical need for early detection. Secondly, support. Based on the risk level assessment, interventions were provided to this youth. For example, the low risk youth received psychoeducation, moderate risk youth receive peer support and counseling, and high risk youth receive crisis intervention and referral to mental health professionals. So these were some of the activities that were conducted as interventions in the different communities and schools that were involved in the project. Support were rendered by the Municipal Health Office, our medical interns, also our invited psychometricians, uh, consulting psychiatrists, trained nurses, and midwives. So support interventions included mental health awareness seminars, school-based mental health classes, on-site counseling. Also, psychiatric consultations were done at the rural health unit. These interventions ensure that youth received appropriate care based on their needs. More importantly, care was brought directly into the communities, and this hopefully reduce stigma and improve access to these health services. Lastly, sustain. To ensure sustainability, we established partnerships through forging of memorandum of agreement with the local government unit, Department of Education, Department of Health, and the UP School of the Sciences. Mental health programs were also integrated into the municipal mental health plan. The most important contribution of this project is to sustainability. So we conducted capacity building workshops by training teachers, parents, student leaders, and SK Federation youth leaders as well. In total, over 180 community members were trained in psychological first aid and youth mental health support. So conducted were trainings on psychological first aid, peer facilitation, and youth focused interventions that were meant to cascade down this awareness into their own barangays and local communities. And I think most importantly is the forging of the creation of a 3-year municipal mental health plan by the local municipality that was developed and formally endorsed to the local government unit. This ensures long-term continuity beyond this capstone project by our medical students. In conclusion, this project demonstrated that the 3S framework can effectively address youth mental health through early detection, through screening, appropriate intervention, and sustainable community partnerships. It shows that mental health care does not need to begin in hospitals. It can begin in schools, in our communities, and even in our families. Allow us to close this message that together we can nurture resilient young minds by listening, through supporting, and through sustaining systems of care in our communities. We can prevent our silence from becoming a tragedy in the lives of our young people. Good morning and thank you, everyone.